So, welcome to the International Society of Nephrology Pre-Congress interview series. I'm Augusto Santos Jr., a nephrologist based in Brazil and also a member of the ISN social media team covering the World Congress of Nephrology 2022. I'm very pleased to have with me today Dr. Samira Bell. Dr. Samira Bell is a distinguished nephrologist. She's a senior lecturer and a consultant nephrologist at University of Dundee in Scotland. She's also the current chair of the Scottish Renal Registry. So welcome, Dr. Samira Bell. I'm very pleased to have you here today with us. Thank you.
Thank you for taking the time to chat to me. It's a pleasure to speak to you today.
I'm going to start by asking you. So we are living in unprecedented times and also in a fast-changing world. So how do you think that renal registries could help us with opportunities to improve care globally?
So I think the pandemic has really shown us how renal registries can be a really valuable way of affecting and influencing patient care for patients who are on dialysis and with a transplant. And we've seen that in Scotland. We have our Scottish Renal Registry, and during the pandemic, we have been linking with other national data sets in Scotland. So we've been linking our registry with vaccination data, with COVID-19 data, hospitalisation and mortality data. And this has been a really important way of being able to examine vaccination uptake across Scotland, but not only that, we've been able to see what outcomes are in patients who are on dialysis or with a transplant who develop COVID-19. We've also been able to see how effectiveness of the vaccination programs. So we've recently carried out work that showed that 2 doses of the vaccine was not sufficient in dialysis and transplant patients. And that's been a very important piece of information which can impact on care globally and influence vaccination programs for this group of patients.
Well, excellent. And so in this regard, one of the things that we're facing is this digital revolution. So we have electronic records, machine learning, the artificial intelligence available. So how do you think these tools can shape the way we collect data and also design our studies so that we can improve our assistance?
So I think we're very fortunate with nephrology because it's a specialty that really lends itself well to data type studies. And as you said, with the advent of electronic health records and advances in epidemiological techniques, as well as machine learning, artificial intelligence, all of these technologies have allowed us to apply these to our patient data and carry out timely studies using real world data. And I think in nephrology, there are many aspects which can't be studied in a randomized controlled trial setting, as it's often expensive or very time consuming or even very difficult to recruit to. So being able to use these advances to influence patient care has been really important, I think, and has hopefully been beneficial in the care, in the treatment of our patients with renal disease.
Yeah. So, and you will be in the team symposium during the WCN 2022. I'm sure your talk, which is entitled Outcomes Following Renal Recovery from ATA, will be one of the highlights of the Congress. So can you give us a glimpse of what will be discussed during this session?
Yep. I'm very excited to be presenting at the World Congress of Nephrology this year. And my talk is about outcomes following renal recovery in patients with acute kidney injury. So I'm going to discuss a bit about the different trajectories of recovery following AKI and also acute kidney disease as well, and how these differences in recovery trajectories can influence outcomes for patients. So that's just a quick glimpse of what I'm going to talk about, and I'm very much looking forward to it.
Well, thank you so much for your time and availability, Dr. Samira. It was really a pleasure having the opportunity to talk to you. I invite all the international nephrology community to join our session and also to follow our channels, our social media channels, and so that they can stay tuned. So thank you for joining us.
Thank you very much. It's been a pleasure.